So we'll start the recording. So thank you, everyone. Good afternoon for making time for this month's PAPRN Plus call. I hope everybody's doing well. We are in for a treat today where we are going to hear a series of presentations from the team from the Physical Activity Research Center, or PARC. And before we get to that point, we thought we'd do a few updates. Unfortunately, Tom is not on the call today, and he didn't have many updates from the CDC. The one thing I'll just mention is, for those of you who have not seen, the funding for the new PRCs was recently announced, and you can head on to the website of the CDC website, or look in the most recent announcement or email that I sent out from PAPRN Plus from the Coordinating Center, and there's a link to all the centers. So congratulations to everybody who was refunded and to the new centers that will be starting their work this fall in 2019 for the next 5 years. So congratulations to everybody. As far as the Coordinating Center updates, well, actually, let me just pause and see if there's anybody else on the phone from the CDC who would like to add anything before we move on. Okay, not hearing anything, and I will also be monitoring the chat box to see if there's any questions. We'll move on. So in terms of the Coordinating Center updates, just want to remind everybody that we're in our sort of final sort of 6 months or so of the current funding for PAPRN Plus. We are into dissemination and continuing to help support the work groups and build on what we did at the most recent ALC meeting to make sure that we're getting our findings out. And so please be on the lookout for opportunities to connect with the work groups, to help spread information coming out from the work groups. And we will definitely dedicate some time on our next call to just sharing those materials. The same thing with the collaborating centers. We've been working with them, and we have a communications person who is helping to support making briefs and other summaries that we will be sharing, again, to help get the research out. And we're thankful to Tom and others at the CDC who've been supporting those efforts. So Karen told me I'm breaking up. I'm not sure why. I'm on a landline, but thank you, Karen. I'll check my phone. If you can't hear me, let me know. I'm sorry about that. But I was just saying, saying that we are moving into, are pushing heavily on dissemination in terms of PAPRN Plus as we're coming down the home stretch is sort of the last 6 months of our current funding. Let me see if I have any questions before we begin with our featured presentation today, and I'm mindful of the time for that because there are a number of presenters who will be speaking today. But let me see if there are any questions on any of the updates. Okay, great. So it's nice to see so many people on the web, the webinar, and Amanda, thank you for running the slides. And so, again, we're in for a real treat today. We are going to be hearing from the Physical Activity Research Center, and if people recall, a couple of years ago when the Physical Activity Research Center was just funded, there was a presentation given that provided an overview of what the research projects were going to involve. And so now that PARC is coming to a close and moving into dissemination and the research projects are completed, we thought this would be a great time to circle back to those projects and for those investigators to share what they've been finding and talking about partnerships and dissemination. So I will turn it over to Nisha, who will be introducing PARC, and then we have a number of speakers who will have 4 presentations, and then there'll be some wrap-up comments at the end. I'll monitor the chat box, but I think we'll save all questions to the end so that we get through all of the projects. So thank you to the PARC team who's on today, and I'll turn it over to Nisha.
Thanks, Keisha. Hello, everyone. So I'm Nisha Bochway. I'm at Georgia Tech, and I have had the pleasure of co-leading the Physical Activity Research Center with Jim Salas. We will run through just a brief overview of the Physical Activity Research Center, and then have short updates from 4 other participants in the center, members of the center, and then close out with Aaron, I think, is our final presenter, and then we'll have some time for Q&A. So next slide. The Physical Activity Research Center was initiated by the Robert Wood Johnson Foundation. It was a new center that aimed to build evidence about the policies, practices, and aspects of the built environment that promotes safe and developmentally appropriate physical activity for youth and families. The center was initiated from this commitment to ensure healthy weight for all of America's children by the year 2025. We understand that RWJF has gone through various strategic changes with regards to their vision that's still being worked through and then will be presented at some point. And so the focus here on healthy weight for America's children is not the current, at least, target for RWJF. They're more focused on a broader perspective than just weight, but realizing that this is where we started, but we too have evolved a bit. The center was announced at the Active Living Research Conference in February 2016, and from there, next slide, we built on what RWJF's big bets were at that point. So the first was to ensure that all children enter kindergarten at a healthy weight. They wanted to make sure that physical activity was a part of the school environment, and also wanted to make physical activity a part of the everyday experience for children and youth. Next slide. The topics that we were asked to consider in this center included the 8 or so that are listed on this slide. I won't read through all of them, but I'll note that what you see here is an emphasis on kind of a non-traditional framework or sourcing of the solutions for children at a healthy weight, or just healthy children and healthy families more generally. We have addressed 4 or so, 5 or so of the 8 or 9 that are listed on this slide, and 4 of those larger studies will be presented in the following presentations. Next slide. And so PARC was really just at the very beginning in 2016. It's hard to believe that we are 3 years later here in 2019 with some really amazing, exciting results from the studies that we will be presented today, and studies that have been presented previously to PAPRN Plus by other investigators who I know are on the line. We are a multi-site team, and so as you may recall from the title slide, you saw multiple university logos. So we are across from Atlanta, Georgia to North Carolina, all the way over to California, San Diego, and then Hopkins in Baltimore, along with Baylor and other investigators that are a part of the center. We have a significant focus, as you know, on conducting research and not necessarily on disseminating the pool of funds that we have to do to seed research in other places, but we actually have conducted most of the research with the investigators on the team. We've been focusing, especially in this last year, on communications and dissemination of our findings. And so this is one of the products that's coming out of the dissemination focus. And then just research that's designed to inform these big bets from RWJF and other partners who we've been connected to. Next slide. This is our team in 2016. Some of us have longer hair, some of us have less hair, but this was the core team that started. And then if we go to the next slide, you can see a list of the co-investigators who have accompanied the other lead PIs. And so I am the first, Nisha Bochwe at Tech, with Anna Kim, who's at San Diego State University, Jim Salas and Terry Conway at UC San Diego, Myron Floyd and Aaron Hipp at North Carolina State, Keisha Pollack and Renee Sid Meyer, Hopkins and Baylor, and then our Coordinating Center with Carmen Cutter, Chad Spoon, Amanda Walker, Wilson Walker, Wilson, and then Deb Rubio, San Diego, and our program officer, Tina Koo, with Tom Schmid from CDC as a consistent support. And so I think the next slide will take us into the YA team. After Anna Kim, who will present the YA slides, we will hear from Terry from UC San Diego, followed by Aaron to talk about Park 3, Christina to present on Play Streets, and then we'll toss it back to Aaron to give you an overview of what Part 2 will look like. Anna?
Yeah, I'm here. Hi, so I'm going to talk about our curricular intervention across the country in different sites with middle school aged youth and around a program called the Youth Engagement and Action for Health program. I am an assistant professor in city planning at San Diego State University. Next slide, please, Amanda. Thanks. So here's some photos of our program in action. We worked with nonprofits, boys and girls clubs, and middle schools in various places, Washington, D.C., Oceanside, rural places in Hawaii. Next slide, please. And we actually visited with almost every site and spent some time, in addition to the coordinated program that was led by adult leaders in the school, we ourselves as researchers actually visited and worked and talked with students about what it means to think about empowerment and leadership and power in the context of physical activity, neighborhood needs, the built environment. And some of those workshops actually produced really great ideas. So for example, in Oceanside, the middle school students thought about what really prevents them from using their school playground and using their exercise areas. And they talked a lot about trash and then came up with like kind of very charming, creative ideas around trash robots and incentivizing engagement from other students and starting a green club. So lots of ideas were produced through the course of this program. Next slide. The goal of having students come up with their own ideas is this larger premise that when youth feel like they are decision makers, that it produces a feeling that can lead to actually a better relationship with their environment and also some increase in physical activity, feeling like they have control over their space and their bodies. So this is the just general model of how we saw improving, like having students collect data, assess their own needs, and then decide what they would like better access to, and then actually advocate for a change that they would like to see in their neighborhoods or their schools or their sites. So that was, again, the purpose of having them kind of brainstorm about what they would like to see changed. So this is the calendar of our activities over a couple of years now. So we did trainings, data collection, students did their work. We then had done our data analysis, site visits, and then we're concluding now with interviews of the adults who are actually receiving the ideas for action around health from the students that they worked with. Next slide, please. So here I'm going to go into actually some of the findings that we have thus far. Next. This was who we collected information from. So very in line with RWJF's mission, we were focused on communities of color. We were focused on looking across different types of places. So we made sure to collect data from rural places, suburban places, and urban places. Suburban was probably the most kind of fuzzily defined, but we were able to come up with a way to do that. And suburban actually ended up being a pretty important category because for some populations, really, you know, if we're talking about populations that are like under 5% of the general US population, we had to to go into certain areas, certain metro areas, and think about the differences between urban and suburban places. So we looked at African American, American and Indian. We tried to recruit there. That was the most difficult group to recruit for us. We looked at Asian American communities, Latino communities, many students identified as multiracial. And we also focused in on Pacific Islander students as well, because we wanted to make sure that we were collecting data from communities that sometimes are understudied. And then next. So the important part for us about trying to understand the YAP program and how effective it is for youth of color, low-income youth of color, is this quality of action, right? So we're trying to connect the ability of students to believe in action and advocacy into actual results around change in themselves, ability to advocate for better health among family members or friends. And this curriculum has components of that, trainings around that. So we wanted to measure that. And we did see some change around hope. I guess we could broadly call it hope, but it's this idea like, do you now believe in change? So this does vary, because as you might already be thinking, for the ideas that students had around what they wanted to see changed, there was different levels of efficacy. So in some cases, the goals that students had around a better walking track for their school might not be realized, but in other places where students said, we would really like to see better play equipment or a dance class added to our middle school programming, that actually was able to be actualized. Or in the case of Hawaii, which is one of our most successful examples, students presented to city council and they were actually able to get like funding for things. So, you know, this post measurement, I think, is to some degree tied to whether or not what the specific site chose to advocate for, how much progress was made towards those goals, and that would be understandable. So white students initially in the pre-results agreed the most with this statement, I am a leader. Other students identified the least with that statement. Latino students had the highest agreement with their ability to affect change, which was a question about, do you think that the things that you want to see changed will actually change? Pacific Islander and Native Hawaiian students felt most comfortable talking with their friends about being physically active, becoming healthier, eating healthier in the post-treatment group. So there was the most degree of change around that. In terms of attitudes towards this program and how it could actually positively change the community, more African American students agreed with that statement than other groups did. Girls and boys agreed at the same level that they could, that they have the hope and believe in their ability to make their school or community a better place. That's actually a really important finding, because in the pre-results we were consistently seeing that girls reported, not that they didn't feel like they had the ability to lead, that actually was about the same, but girls reported consistently lower levels, dramatically lower levels of physical activity among themselves and even with friends. And then rural students, this is the only place-based category of students that actually declined in agreement from the pre to the post with the program's ability to affect change. And this goes back to my earlier point about there's definitely some attachment to whether or not that group was able to see the outcome that they wanted to see. Next slide. Okay, and then this is the kind of focus of our study, as we were seeking to understand the relationship, the possible relationship between activating advocacy in youth with improved physical activity outcomes. And actually we did see statistically significant increases in physical activity when comparing the post groups. So there was an intervention group that participated in the YAP program, and then a group that was the control group, and they did not receive the program. They just did their usual regular after school activities. So African American students who were in either the treatment and control groups actually both saw a number of days physically active, but for example, the girls in the intervention group versus the girls in the control group, they actually ended up being dramatically more active, physically active during the post results. Within the suburban and urban groups, there was actually a pretty big decline in the number of days physically active for the control groups, but the students that participated in the app program, there was an increase in physical activity. Other findings that were relevant that we found around why students in general in some areas were not as physically active, particularly possibly a reason that is also connected to gender, is that there was a lot of fear from parents, students expressing a lot of fear from parents about where they could be physically active and just in general that they should not walk to school. So there was definitely really low rates of walking and biking to and from school. Most of physical activity is tied to school, school-based activities. And then I think there's just one more. Okay, that's it.
Great, thank you, Anna. Really appreciate it. Again, everyone, please note your questions down for Anna. I know Anna has to leave a little bit early, but Nisha will be available to answer questions as well. So we'll turn it on to the next speaker. Thank you.
Hi, this is Terry Conway. I am at UC San Diego, University of California, San Diego, work with Jim Salas, and I'm presenting on behalf of the UCSD team today because Jim Salas is in Australia at the moment. Our study is titled Racial Ethnic Variations in School Year versus Summer Differences in Adolescent Physical Activity. Next slide, Amanda, please. With regard to background and rationale for the UCSD study, there's been previous research that has influenced the design and the aims of our study. For example, youth obesity prevention efforts have not been as effective in lower income areas and communities of color. So we need better evidence to guide more tailored approaches to subgroups at highest risk for obesity. Also, children and adolescents can gain up to 3 times more weight in the summer than the school year. And this weight gain is greater in some race ethnic groups than others. And somewhat surprisingly, at least it was to me, when children and adolescents are consistently less active in summer than in the school year. But however, there has not been race ethnic differences reported in the literature previously. So our study was designed to improve understanding of school year versus summer differences in physical activity and specifically among high-risk youth. Okay, next slide. Thank you. Our study aims are twofold. First, to examine physical activity and sedentary behavior among diverse subgroups of adolescents in low-income areas who tend to be of color, or adolescents of color as well, and these groups represent higher risk kids usually. The second aim was to examine preferred activities, places that kids prefer to be active, and several psychosocial resources that have previously been shown to be related to physical activity, and all doing so in these high-risk youth. Our primary analysis comparisons were across 3 dimensions. Obviously, summertime versus school year was key. We also were examining differences among race ethnic subgroups and sex differences. Our study sample ended up being 310 youth, all aged from 11 to 17 years of age. There were 310 that completed at least one assessment, but our primary subsample of interest so that we could examine seasonal effects, school year versus summertime, were 207 youth, because these kids did the surveys twice. And of these 207, there were 150 who also wore accelerometers in both seasons. As I already mentioned, all youth were recruited from low-income geographic areas, and we checked their addresses against census data to make sure they lived in areas that were below median income, either for the county that they lived in or the state when we were dealing with some low population density areas. The analysis compared race ethnic groups in 5 categories. We had 56 African Americans, 30 American Indians, 21 Asian Pacific Islander Filipinos. We had to combine these groups because this was our hardest group to recruit. We had 49 Latinos and 51 white non-Hispanics. So as I've already mentioned, our basic methods were to get kids to complete all assessments twice, once during the school year and then once again during summer break. Our data sources were from 2 sources, surveys, where we ask kids to report on their physical activity, sedentary behaviors, preferred activities and places to be active, and select psychosocial variables, again, ones that in the literature has previously been shown to be related to physical activity. And then the second data source was accelerometers. We asked them to wear the meters for about 10 days, and they ended up being fairly compliant, and the vast majority of kids wore the accelerometers for 7 days. And that's what we use to construct objective measures of moderate to vigorous physical activity, minutes per day, and sedentary time in terms of minutes per day. Yeah, I'd like to share graphs for 4 key outcomes that illustrate our school year versus summertime findings. And just 2 of the graphs will be for physical activity outcomes and 2 for sedentary outcomes, just to give an overview of the key findings. The first one is on moderate to vigorous physical activity accelerometer measured. So this is our objective measure, reliable objective measure of overall at moderate to vigorous physical activity. And these measures are constructed to be minutes per day. Just to give you kind of an overview of the structure of the graph, because I know it's a little overwhelming to look at. These 4 graphs, all of them have the x-axis, or along the x-axis, you'll see the 5 race ethnic groups, and to the far right are male-female comparisons. So the blue lines represent averages for school year data, and the yellow bars, or the blue bars, I should say, the yellow bars represent averages for summertime data. In terms of, this was a pretty striking finding for us, especially considering it's a reliable, objective measure of moderate to vigorous physical activity per day. And you can see that there are declines from school year to summer that across all 5 race ethnic groups and both sexes. So it's a very generalized, the decline from school year to summer and less activity in the summertime. In fact, moderate to vigorous physical activity in the summertime is a very generalizable finding. The decline from school year to summer was greatest among American Indians, with a decline of being about 27 minutes per day. And it was the least decline for white non-Hispanics, only about 5 minutes per day. The decline also was greater for boys, about 17 minutes per day, than for girls, with a decline of about 10 minutes per day, 10 minutes less in the summer. In terms of identifying, using these data to identify the highest risk groups, American Indians, Latinos, and girls had the lowest objectively measured MVPA in the summertime. So these represent groups that would be considered particularly high risk. Okay, the next one, please, Amanda. Active transport. This graph is self-reported data, reflects self-reported data from the survey. And kids were asked to self-report the number of times they went various places, either by walking, biking, or skateboarding. And the pattern of results across groups varied. So there was no consistent pattern for active transport the way, in terms of change from school year to summertime, the way there was in objectively measured MVPA. But again, this is a different measure. This is the self-reports of active transport. However, there was a significant ethnic group by seasonal statistical effect, but this was due mainly to the Asian Pacific Islander group. If you look kind of in the middle of the graph, they were the only group. They had a significant, strong increase in active travel during the summertime. But again, this was the only group that showed that kind of a strong effect. There was no sex by timing differences either. So quite variability in the active transport measure. Okay, the next slide, please, Amanda. This is back to the accelerometer-based data, but this is now the overall sedentary time, again, objectively measured by accelerometer. And where we saw very clear differences in the MVPA measure, there were no differences really in the sedentary time. It was very uniform across age groups, or excuse me, not age groups, but across race ethnic groups, of about 8 to 9 hours of sedentary time per day. However, there was a sex effect. girls had a significantly more sedentary time than boys. They averaged about 12.5 minutes more per day of sedentary time than boys. Okay, next slide, please, Amanda. The second sedentary outcome we wanted to show was screen time. And this measure is, again, self-reported, but it reflects the number of minutes per week the kids said they watched TV or watched movies or played video games or were on the computer looking through the internet. So screen time overall. This outcome definitely showed that in all race ethnic groups there was an increase in screen time in the summer, except for American Indians. The summer increase in screen time was particularly high for African American adolescents, and this is a finding that is consistent with previous studies of television viewing and screen time. The next slide, please, Amanda. Okay, the graphs were some of our key outcomes, and they represent the patterns of findings we found. But I'd like to present, just sort of summarize key other findings that we found, and mention an interpretation that's relevant for possibly designing tailored interventions, or maybe the need not to do that. So we found that moderate to vigorous physical activity was lower in the summer than school year in all subgroups. The mean difference overall was about 14 minutes per day less in summertime than during the school year. And the biggest differences were among Latino, American Indian, and Asian Pacific Islander youth. Also, there was a trend for bigger differences and bigger declines among boys than girls. Our interpretation of this finding is that lower summertime MVPA was found in all subgroups, so interventions are needed for everyone. But they may still need to be tailored for each subgroup, but each subgroup would benefit from interventions to increase physical activity during the summer. There were no seasonal differences in total sedentary time, so no differences between school year and summertime. Reported screen time, however, was generally higher in summer, with the biggest increase among African Americans and no differences among American Indians. So our interpretation of these sedentary outcomes are that, similar to previous reports of TV time for African Americans, interventions to reduce summer screen time should be prioritized for African American youth. Another finding that we found only in Asian Pacific Islanders were that active transport was much higher in the summer. But this was the group where we had the fewest kids, only 21 kids, so we definitely would recommend further research to understand reasons why this might be true, and certainly to replicate that it's a reliable finding. With regard to activity preferences, self-reported activity preferences, walking was by far the most preferred activity across all subgroups and across both seasons, during the school year and during the summer, with the exception of white adolescents during the summer. Also, reported exercise and running were probably the next popular across groups, with water activities being more popular in summer. So an interpretation of these preference findings was that walking should be a priority target behavior across all subgroups. With regard to preferences for where kids like to be active, physically active, generally in and around the home and the school grounds tended to be the most commonly reported places where kids said they wanted to be active. And there were very few differences between seasons, between school year and summertime. So this preferred place of being physically active in and around home, although this is true, it was higher in summertime than the school year, a little bit higher. And summer preference declined for wanting to be active at school and fields or sports fields or courts. Parks were, a little surprisingly, were rated somewhat low as a preferred place to be physically active, but parks were the most preferred place for American youth, particularly in the summertime. So our interpretation of these preference findings is that it's obviously physical activity in and around the home highlights the need for safe environments, but it's also represents a challenge to try to create convenient programs for neighborhoods, since there's not much you can do in and around the home. With regard to psychological variables, probably our most interesting difference was a lower enjoyment of physical activity in the summer. And this was found across all groups. Our interpretation of this is that it's likely that kids don't have access to doing activities with their friends in the summer. And since kids like to be with friends, it's probably the lower enjoyment in the summer is probably because of fewer activities for group activities for summertime programs. But that might be something to target. Just also in summing up, want to acknowledge some strengths and limitations of our study. Strengths include the fact that we were able to analyze, and few previous studies have been able to analyze results by multiple race ethnic subgroups. We use both device-based and self-report measures of both physical activity and sedentary behavior. And we prioritize measuring preferences for activities and places along with psychosocial variables. And knowing what kids say they would like to do in terms of activities and places to be active can help guide development of subgroup tailored interventions. Of course, some key limitations are our small sample sizes within each race ethnic subgroup, and we couldn't consider our subgroups representative population samples or population representative samples. Okay, that sums up part from UCSD.
Okay, great. Thanks, Terry. So we're going to move right along to Aaron, and so thanks everybody for holding on. We have 2 more brief presentations.
Hi, everyone. Good afternoon to those in Central and Eastern time zone, and good morning to those Mountain Pacific. I'm just the mouthpiece for our project based here at NC State. Dr. Floyd is the PI, and I'm the co-PI. Our part of the larger park group was to investigate park-based physical activity. Our project had 3 specific aims. The first, to identify attributes of parks associated with the parental decisions for child's use of park. Just like with the other projects, we did focus on youth. We did focus on youth from low-income communities of color. So really, aim 1 was thinking through, parents' decisions for their children to use or not to use parks. The second study aim was focused on the facilities and programmatic aspects of parks that helped get kids into parks. Again, specifically looking at how that varies by different racial, ethnic, and gender groups. So we have the parents' decision, we have actual use getting into the park, and then our third aim was really focused on that park-based physical activity. So once the children and families are inside parks, where are they active? Where is that moderate and vigorous physical activity occurring? Next, please. Really just a pretty similar slide to the previous, just kind of our conceptual diagram here, ending with children's park-based physical activity. We measure neighborhood environment, park characteristics, parent perceptions, and then children and family use or non-use of parks, all leading to that goal of looking at park-based physical activity in children. Next. We did this with a mixed methods approach. Our focus were children ages 5 to 10 years old. We focused in New York City on Asian American and Latino American populations. These were 20 parks located in neighborhoods identifying primarily as one of those 2 race ethnicities, and at 80% of the median household income for the greater New York City area. And then in Raleigh and Durham, we focused on African American and Latino American populations, again in neighborhoods with a large percentage of population identifying as such, and at 80% of the median household income for Durham and Wake counties. So 40 total parks across these 3 cities. Our 3 main methods, we did a household survey. This was actually a national level household survey of low-income families, 80% identifying as non-white. These were parents answering questions about some of the decisions for children 5 to 10. We completed systematic observations as well as environmental audits of the parks and the streets surrounding the parks, the 20 parks in New York City and the 20 parks in Raleigh and Durham. We visited these during the school year and during the summer in 2017 and 2018. And then finally, in all three cities, we participated in in-park monitoring, where a total of about 400 children between the three cities wore accelerometers and GPS with a 1-second epoch for a minimum of 15 minutes during their visit, while their parent or guardian completed a paper or iPad-based survey about use. So those are our general methods. Next, please. So just some kind of high-level results across some of our projects. So at this point, we primarily, because of all that data, we're really just have gotten out the systematic observation data. And so some of our early findings, the first published piece from this project was in Urban Forestry and Urban Greening earlier this year. And so in New York City, across 80 visits to parks, actually 160 visits during both seasons, we observed over 16,000 children. That's children 5 to 10 years of age in the parks across those visits. And so just looking, because we had an average of about, I think, 8 target areas per 20 parks. Each park had to have at least one playground where you would expect kids 5 to 10 years of age, as well as some type of sports court, generally a basketball court, but also soccer fields, baseball fields, etc. So with the reference being playing on a playground, which is, you know, your monkey bars and slide, we found more children on swings versus the traditional harder equipment of monkey bars and slides. There were fewer children in splash areas. That's accounting for the seasonal differences between April and August, which were our seasons of school year and summer. The other areas were generally kind of your grassy areas or your open areas of play that were not designated as a sports court, a splash area, playground, or swing. And we found that there were more kids out in the sun versus in the shady areas, again, accounting for monthly and seasonal variations. So just a few of the results published in that paper. Next. You know, another paper, this one's under review. If any of your reviewers right now, be kind to us, please. So this is looking at, this is cross-sectional data. This is New York City data, but this is SOPARK data as well. So looking at 5 to 10-year-olds versus the teens that were present in the park. Here, the bars represent presence, so the counts per observation. And you can see on the left side of the screen, this is female or girls. And so you can see, compared to 5 to 10-year-olds, there are significantly fewer teens within these parks. And that's accounting for all target areas. And then the line here is METS. So this is your physical activity. And you can see there also is a significant decrease or a significant difference between how active teen girls were in park versus younger girls in the parks. And then on the right are males, and you can see that there is generally a reduced presence of boys in parks, teens compared to younger kids, with the exception of African American boys, where there is an increase. You can also see with the lines here that the METs did not change significantly when you're comparing 5 to 10-year-olds to teens. So a few things here. You know, a lot of teen boys are playing sports, soccer, basketball, and being quite active. Also of note is just in the literature, and something that we've had a hard time trying to parse out in our own observations, is the over-identification of African American boys as older, as appearing or observing older than they actually are. So that may play into a little of the African American teen to 5 to 10-year-old result. But in general, girls are less present and less active as teens compared to 5 to 10-year-olds. That is not seen as much on boys, especially with considering the actual activity level within park-based physical activity. Next, please. This one, if you were at ALC, this was kind of the slide that I presented there. This was crime. So we have SOPARK data. We had 80 visits. This is just spring data here. We had 80 visits and then looked at crime within a half mile of the 20 parks in the 1 week, 1 month, and 3 months prior to each of those 80 visits. And so we have boys and girls here, as well as violent crime, which is to the person, and property crime, which is to property, housing, or cars. And so really the take home here is that violent crime against people, has a larger effect, and all crimes seem to have a larger effect on girls versus boys in terms of reducing their presence in parks. So the more crimes, the fewer present in parks. Next, please. Moving forward, we are looking at our accelerometer and GPS data. This is Rappaport Playground in an Asian American low-income neighborhood in Brooklyn. And so here are the red blobs, especially the one on the far left. This is a hot spot of high intensity physical activity, and that happens to completely overlay the playground. The blue blob in the middle is a cold spot where you've got a significant clustering of low physical activity, and that happens to be around the water area and the benches. And then to the far right, you can see some of the red clustering at one side of the basketball court, and then some benches along the side of the basketball court. So just an example of where we're going with our research moving forward. Next slide, please. So we've got a lot of data, we've got a lot of partners, and we're very much considering and speaking with our partners on how to communicate our results so that they are of most use. An example is, you know, we feel like we can provide a nice evidence base for the park master planning and budgetary considerations moving forward, so that if a master plan or a Kaboom's coming in the area and they're looking to get the most bang for their buck in terms of physical activity within parks and low-income communities of color, we feel like we'll be able to confidently give them the evidence base for here are the structures and the placement of structures to hit physical activity goals. Next slide, please. Yep, I'm just the one presenting today. Dr. Floyd's our PI, myself, there's Oriel Marquette, our postdoc, Claudia Alberico, Jean Wong, our PhD students on the project, and Beth Mazak, who is our project manager. Thank you.
Great, thanks, Aaron. We'll turn it over to Christina.
Hi, everyone. I'm Christina Bridges. I served as the project coordinator, and today I'm really excited to get to talk to you about implementing play streets in low-income rural communities. Next slide, please. So I am just the one presenting today, like Aaron said, and so I would like to thank our study team who helped us, Keisha and Renee, design the project, and then all of our data collectors that helped us collect all of the magnificent data that we have. Next slide. So a little bit of background. Communities lack features of built environment that support physical activities such as parks and sidewalks, and we especially see that in low-income communities and communities of color. And some permanent changes to the built environment are not necessarily always feasible to be able to make those changes. And rural communities specifically face unique challenges. So we believe that play streets, which are a temporary street closure that for a specific time period, which is usually a minimum of 3 hours, help create a safe space for children to play and be physically active. And so far, play streets have only occurred in urban areas, which is why we wanted to investigate what would happen if we implemented them in rural environments. Next slide, please. And so we had 5 specific aims for this study, the first of which we've already achieved. We have had an academic literature review accepted as well as a gray literature review accepted. And aims 2 through 4, we successfully implemented during the summer of 2017 is whenever we mainly had all of our play streets happen. We had 16 total play streets, 4 in each of our 4 rural diverse communities. And then aim 5, we're working on developing a resource guide as we speak to help describe how to plan and implement these play streets in rural low-income settings. Next slide, please. So I wanted to just briefly present the physical activity data that we have found. We collected observations via SOPARK, and we also collected pedometer data. The main thing that we were really excited to find is that children are active at play streets, which made us very excited. And we found no significant difference between activity levels for boy and girl children. The only significant difference we found was in the pedometer data for ages 12 through 15 years. Girls had significantly fewer steps per minute than males. Next slide, please. So some key adaptations we had to make of play streets to be able to implement them in rural communities is the location. It wasn't necessarily feasible to hold them on a street. And we had to pick, our community partners had to pick locations that were accessible to the majority of people because the distance to travel to the play street could possibly be across town. And many times we saw play streets coupled with other events that were happening in the community to help people be able to only make that commute once and be able to go to multiple events. Next slide, please. So the way we identified our communities, we followed the parameters that the parks team had set regarding low income and rural for those definitions. And we found communities that were ready, so that had experience either putting on events or had experience recruiting volunteers. And we sought to have racial and ethnic diverse communities. And to get these communities or get in contact with these communities, we use our existing networks. And this was all very time intensive and included having to make lots of phone calls and in-person meetings to be able to build those relationships with those community members before we came in and implemented these play streets. And if we go to the next slide, we'll see a map. And this wasn't necessarily an a priori thing that we wanted to have happen, but we ended up having 4 different community organizations throughout our locations. And you can see that because Renee is based out of Baylor and Keisha is based out of Johns Hopkins, we did try to pick geographically feasible locations for us to be able to visit in Oklahoma, North Carolina, Maryland, and Texas. Next slide, please. So to support implementation in each of these communities, we developed a legally binding agreement between Johns Hopkins and each site, which is how we were able to provide them with mini grants. There were pre-implementation meetings and calls with those lead planners before each of the play streets. We provided some resources and technical support, but we mainly gave minimal direction so that the implementers could do what they wanted to at their play streets. But one important thing that we had heard from people who implemented play streets in Chicago is that branding is very important. So we created a logo that you see here, and we also provided that logo on t-shirts for each of our community implementation teams. Next slide, please. So our key messages we're trying to achieve for dissemination is that play streets provide opportunities for outdoor physical activity and play in communities that lack access and safe and well-maintained parks and playgrounds. Play streets in rural communities are usually not on streets. They're in places such as parking lots, fields, school grounds, or existing parks. Kids are active and have fun at play streets in rural settings. Adult guardians felt that play streets provided safe places for kids to play outdoors and be physically active, but we necessarily didn't see the adult guardians being as physically active with the kids as much. It was mainly the kids were the ones being physically active. And play streets support health equity and community cohesion. Next slide, please. So our 3 key audiences we're trying to reach whenever we're disseminating our products is all of our 4 communities. We plan to go back to them in the summer, this summer in 2019, and present to them all of the findings that we found whenever we were in their communities. Whenever we present to researchers, we have 2 accepted manuscripts like I had mentioned, 1 R&R, and several other papers that are being prepared. And we have also had the opportunity to present at multiple academic conferences. And then for practitioners, we're widely disseminating an implementation guide that we're still creating. We've submitted an abstract to NRPA annual meeting, and with those 2 systematic literature reviews that I had mentioned, we opted to publish them as open access. So practitioners could also get access to those. And then we're also seeking any other opportunities to be able to disseminate all of this information to other practitioners interested in doing this. So please let us know if there's any other things that you have thought of that we haven't tried. Next slide, please. And before I hand it back over to Erin to talk about Part 2, I just wanted to say a huge thank you to all of our community partners and Robert Wood Johnson for funding through the PART Association. Thank you.
I'll just say a few words here so that we have at least 2 minutes for questions, but really we're all continuing to work during these last 4 or 5 months, especially on communicating our findings with key partners. And we're kind of both expanding and retracting our focus a little bit. Really the idea around Physical Activity Research Center is with children from low-income communities of color is reframing this and communicating with those communities about play, and that play is happening anywhere, whether it's in rural communities through play streets, whether it's near homes as found in the summer work at UC San Diego, or more traditional spaces like we have found with our parks work. And so really focusing on the idea of play, and also that it's not just the kids playing, but it's their siblings and their guardians and their parents, and how can play in these different environments help facilitate social cohesion, social engagement, and broader community well-being. And that's really where we're trying to pivot the work as we look forward. So with that, we've got 2 minutes for questions. All our contact information is here, and just to point out that we are in schools of medicine, public health, natural resources, and city and regional planning, and so we're trying to leverage those that variety of expertise as we move forward. So I'll turn it to Keisha to guide any questions for the group over the next 90 seconds.
Yeah, great. Thanks, Erin. Great job, everybody. As Erin said, we only have about a minute for questions. Please email low questions. We would love to have them. Sorry we couldn't get to all of them today, but does anybody have or one question we have time for any of the presenters before we have to wrap up? And I'm monitoring the chat box. I don't see anything here. So let me just a thank you. So let me just assume that people have questions that are too long to answer in the next 30 seconds. And so again, I encourage you to please contact the leads for the projects or send your question to me, and I can make sure they get to the appropriate person. So as we're wrapping up, let me just say thank you to all of the presenters for making time today to share their findings and just how exciting we are for these results. Thank you, Amanda, for managing the slides, and want to encourage all of you to reconnect with us for our next call, which will be on May 23rd. That's the Thursday. We usually meet the last Thursday of the month, but that's close to Memorial Weekend, so we'll meet the week prior. We are looking for presenters, so if you're interested in sharing your work, please reach out to us. Thank you again, and we look forward to hearing from you if you have questions after today. Take care, everyone, and enjoy the rest of your week.
Thanks. Bye-bye.